My name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas. And today we're going to talk about borderline personality disorder and relationship dysfunction, or the tendency for dependency. Then what I'm going to do is I'm going to break these up into two videos because it's kind of long and I don't want folks to be overwhelmed with a lot of information. I want to be able to break it in half so you can kind of take your time, process this information, see if you can apply it to yourself and your situations, and perhaps gain some insight into how you're perceiving your relationships, and perhaps how you're perceiving your partner, and what some of those core content issues might be that's driving you to behave in particular ways, which may be sort of expressing this maladaptive content and behaviors that could be causing you problem. So let's get started. So it's not uncommon for individuals with borderline personality disorder or those with traits to feel as though they need to be in a relationship, to feel complete, and to feel like they exist. And now this is something I often work with a lot of my clients, and it's about learning about this tendency for dependency and the related patterns can help you see yourself and your relationships differently. And that's what my hope is, because the goal of this video is to help you reconceptualize how you see yourself as a whole person, as a complete person, okay? But also how you see yourself in your relationships. Now, wanting to be in a relationship is great, but needing to be in one tends to be frightening and triggering. Now, I want to be sure that you guys hear me say this, that wanting to be in a relationship, that's healthy. That's a good thing. Needing to be in the relationship is where that dependency comes in, that you need to be in this relationship. Otherwise, you feel broken, unneeded. Some folks get to the point where they don't feel like they exist unless they are in a relationship. And those are all indicators that it's a need-based relationship. Want-based relationship is you want to be in it, that your needs are getting met, and you appreciate that. But if things go south or if things become unhealthy, that you're willing to walk away or address the issues to the possible extent that your partner walks away. And even though you'll be sad and you'll miss the relationship, but you understand that it's better for you. That's wanting to be in the relationship. Okay. So now knowing your patterns and driving unhealthy forces can help you do your relationships differently. And that's what we're going to try to do. I want to move you more towards an adaptive and healthy way to conceptualize yourself within your relationships. Now, individuals with BPD typically have a difficult time tolerating aloneness, as well as they tend to experience this intense fear of loss, abandonment, rejection sensitivity that is related to their significant others. But they also have this it's sort of like an urgent need for contact with significant others when they're stressed or distressed. And this is often accompanied sometimes by this highly submissive stance, subservient behavior in some cases. And this tends to lead to trouble. This tends to lead to difficulty in that relationship because you lose who you are in that relationship. Now, perhaps, and this happens a lot with folks that have borderline personality disorder, they don't know who they are to begin with. And so they hope that the relationship will help them figure that out to define them. But what happens is it becomes more complex because now you've added in this whole other individual. And that adds so many other factors. And all of that kicks into all of these core content, interpersonal functioning patterns that we see, and that's what we're going to go over today in this video specifically. But we want to help you learn these patterns. And when I say we, that's you and I learning together learning about these patterns so that they can help you to do things differently. Understanding your core content empowers you with the ability to choose what to do, which your choice means that you don't need to be in the relationship, but you're there because you want to be. And that's where we want to be. That's where we want to get you. So let's talk about, again, in this video, we're going to talk about the first three, and then I will then put out another video that'll have the final three as well. So the first one. So this is these are for individuals that have BPD traits or borderline personality disorder. And this is an unconscious wish to be heard, combined with the absence of a wish to help others that is partly compatible with the idea of a punitive parent mode in which the individual internalizes the parent who devalued and rejected the individual in childhood. Okay? So now if this is a little confusing, what this is it's that you act to your detriment to please this parent that's inside of you. Okay. And what happens with folks like this is they carry this idea that my misery is your command. And that is that I will please you by hurting me the way my parent or caregiver hurt me growing up. So you end up in these cycles. It's called a recapitulation. You end up in these cycles over and over again of these unhealthy, harmful relationships and connections and seeing yourself. So it's difficult to break free because you're always trying to meet this need of the abusive parent to your detriment because you believe that the parent, the better you will be, the more broken you are. And if it sounds confusing, then that makes sense that it would often be confusing. But some folks who experience this, these folks may be saying, yeah, I get that. I hold on to that. I have that internalized parent inside of me that you get a degree of unconscious satisfaction. You're like, oh, great, I messed something up again. I feel so satisfied inside. But what happens is that there's a part of you, a piece of you that's like, see, I should have messed up. So I met my goal that pleases my internalized parent. Okay. Now the second one, this is a wish to be good and do the right thing combined with feelings of shame for not being good enough. Now individuals with borderline personality disorder, they see themselves as defective, bad, unwanted, inferior, or invalid, or that they are unlovable to significant others if they expose or if they acknowledge these flaws and failures. So you're putting out this idea that you have no flaws and failures, but inside you have this unwanted, inferior, bad sense of self, this unlovable self. But I can't expose that because if I do, then that makes me unlovable. So if I hold this idea that I have any failures, any flaws, or any sort of chinks in my armor, then that person will leave me and I will be alone. So I have to put forth this presentation of suitability, of managing situations well, perhaps of having no stress, until what happens is you hold it down, and you eventually explode. And that explosion can be self-harm, harming others, verbal assault, physical assaults, things like that. And that can destroy the relationship, which then, of course, you turn on yourself, saying that, see, this proves that I am bad, I am unwanted, I am inferior. And then so you justify that sense of who you are. So again, this goes in all of these are very cyclical. It's that recapitulation, and it goes around and around, and it becomes cyclical because you keep living out or engaging in this cycle over and over again. Now, the last one that we'll talk about in this video it's called a receptive interaction. And this is individuals with borderline personality disorder, right? That they want to be opened up to, okay? They want to have their partner express their feelings, thoughts, and concerns, and they feel happy and satisfied when this occurs. There's no negative side to this. Okay. So, and what happens is that these are folks that have understood their core content. They understand that in relationships that you want to be in, that you can be honest with yourself, that you can express yourself, you can open up, and that encourages others to open up to you. And if people open up to you, or if they used your faults against you, those aren't people that you want in your interpersonal circle. Those are people that are validating that borderline personality disorder components of your personality, of who you are. So what happens is in this receptive interaction is that you put good things out, you honestly and assertively express your feelings, and your partner does the same. And that builds to a want to be in the relationship, not that you need to be in the relationship, because that needed relationship, right? You would never open up out of fear of looking flawed, broken, insufficient. Okay. And then the person that you tend to get into your interpersonal circle is not somebody who's inclined to open up to you. So again, that reinforces this recurrent, these unhealthy interpersonal patterns. Now that's only 3. So we only talked about 3. And in the next video, we'll talk about another 3. But what I want you to do is I want you to ask yourself, which of these 3 that you engage in, does this relate to your core content? It's really important that we identify core content, what's driving these surface structure behaviors, all of these symptoms related to borderline personality disorder. What's driving it? That is your core content. It's hard to get to, okay? And what do you do to try to manage these core content issues. And that's typically where that maladaptive patterns come in, those maladaptive behaviors and beliefs and things like that. That's where they kick in to manage what's underneath that core content. Okay. Now, if you tend to use maladaptive patterns, that's fine. It's very common for a lot of folks. So try to find positive coping strategies to replace it with. Easy to say, hard to do, but work to do it. It's not something, that you can do in a day, that it takes time to build this skill, but it is something that you can definitely do. Now, I have found that when my clients with borderline personality disorder, when they begin to see their relationships as something they want to be in and not need to be in, and they recognize that whomever they are with may not be the end all be all of all significant others, right? That it's not bad, that it's just not the last person to love them. That it's important to remember that if you were in a relationship and someone loved you once, someone will love you again. And I know that that's contrary to what that core content is telling a lot of folks, that this is the only person who will love you. This is the only person who understands you, or all these other factors. And it's just not statistically true. It may feel that way, and I certainly understand that. And it's that way, for a lot of my clients too. And we learn about what this core content is how these unhealthy relationships really satisfy that core content need. And that can empower you. That empowers my clients to look at it and examine it and say, you know what? Maybe I don't deserve A, B, C, D, E, F. I mean, we can go through the whole alphabet, right? And maybe you don't. So again, remember that if you were loved before, you can be loved again. Now, this is a hard challenge, and it's important to build up and recognize your worth as a person, not to others, but to yourself. And that's so important. A lot of folks with borderline personality disorder have so many great gifts, and they have so many great abilities, and it tends to get shrouded with all of these surface structure behaviors and all of this pathology and all of this sometimes violence and abuse outwardly or inwardly. But it is possible to grow beyond and control these things. The second group of 3, interpersonal functioning patterns. Now, in the last video, we went over the first 3 interpersonal functioning patterns that tend to be related to core content of borderline personality disorder. Now, in this video, we're going to go over the final 3. Now, as I describe them, I want you to ask yourself if this is something you feel inside yourself about how you see and feel about yourself and those in a relationship with you, not just romantic. This could also be in work relationships, family relationships, friendships too. So all of these things, how do these play out? And a lot of us, I think, when we hear relationship dysfunction, we think, oh, well, romantic relationship, but not necessarily. So we can broaden that out to that. How does this factor into work relationships, family relationships, and friendships as well? So let's get right into it. So this is the first one in this video we're going to talk about, is that it's anxiety about autonomy and independence. And what happens is a lot of folks with borderline personality disorder, they may hold the core belief of incompetence, that they lack faith in their ability to achieve or to successfully tackle tasks on their own. And this leads to conflicts about their independence because they don't feel that they can achieve things on their own. They resort to finding others who can take care of them, who can do these things for them. And by doing this, what ends up happening is they end up forfeiting their wishes in attempts for autonomy and independence. So you give up that autonomy and independence just to stay in this relationship. And that can really, talk about tendency for dependency, I mean, that can really set you up for that, because this puts you back, just as we talked about in the other video, about being in that relationship as a need to be in that relationship, as opposed to a want to be in that relationship. Okay, and that's talked more fully in the previous video. Now, the next one, this is called that dependent and depressive factor. And this is when you have feelings of depression that are conflicted with autonomy. As individuals with borderline personality disorder, they are reported to be depressed as a consequence of their fear of losing a significant other, because they do not believe that they can survive on their own. So this is that depressive dependency issue, and this is that dependent depressive factor. And it's that, that you feel like you're trapped in this relationship. You need to be in this relationship. And because you feel like you have no other options, perhaps it's not a healthy relationship. And part of you knows that, but you don't feel like you can get out, or the loss of that significant other is so intense that kicks off or maintains this depression. Now, I've also done a video on depression and borderline personality disorder. I'll put the link here. And it is different for folks with borderline personality disorder traits who experience depression. So it's important to be aware of that too. And this is an additional factor related to that as it pertains to relationships as well. Now, the last one, and this is successful interactions, is the desire, okay, to be irresponsible. Now, the last interpersonal pattern that we're going to talk about, that this is the successful interactions, is the desire to not be irresponsible, such as to take responsibility for our behavior, our life, our feelings, and how we see the world. And you accept others for who they are and where they are, and feelings of pride and confidence in yourself and in the relationship. And I think sometimes it's hard for folks with borderline personality disorder to really see their partners, or to see their coworkers, or to see people that are in their interpersonal circle, because of this distortion that comes with borderline personality disorder traits. And this distortion sort of feeds that core content and causes and maintains those maladaptive patterns. And that's not what we want to do. We want to get to the core content, have an authentic view as to how we see the world, and interact with that authentic view so that we can be efficacious, we can interact effectively, we can see our partners for who they are, and really be able to determine, is this a relationship I want to be in? And if you don't, what are steps to get out? And sort of looking at that, but recognizing that that doesn't mean you lose who you are. The relationship doesn't make you who you are. And I know that there's a lot of factors of borderline personality disorder that make people feel that way. If I'm not in a relationship, I don't exist. If somebody doesn't tell me they love me, or if somebody doesn't do A, B, C, D, then I don't exist and I have no worth. But that external validation, that constant external validation, puts you in a deficit position. And that is a lot of times where that borderline personality disorder, where it wants to keep you. And that's a difficult and hard way to live. And to do it differently is scary, certainly understandable, but it's not impossible. And what I want you to ask yourself in these three interpersonal patterns that we discussed, ask yourself which of these you engage in. Does this relate to your core content and what your surface structure behaviors, what you do to try and manage these core content issues, right? What's underlying that, to try to manage that? What are those maladaptive patterns that feed this core content? Now, if you tend to use maladaptive patterns, which a lot of folks do, try and find other coping strategies. What are some positive coping strategies you can use when your core content is ignited, is kicked off? Okay. And then now try to use this information to grow beyond that tendency for dependency. You really can do it. I know it's hard and it's certainly scary, but the idea of being alone, I understand, is scary for a lot of folks with borderline personality disorder and otherwise, not just for folks that have this particular personality disorder. But it's important to be comfortable being alone and being who you are. And once you're able to do that, you find that you get into relationships more on a want than a need. And you can define your borderline personality disorder. It doesn't have to define you. And that is a hard place to get to, but you can get there. It's really possible. It really, really is. And my hope is that these videos that I make, and this one in particular, that it empowers you with the knowledge so that you can make choices to identify your core content and control your surface structure behaviors and make them more adaptive. And when you control and manage them, you are more likely to make adaptive and healthy choices. And that's what we want. Those healthy and adaptive choices that move you forward, that help you succeed, that give you a sense of self-satisfaction and worth. And a relationship can't do that for you. And it takes a while to learn that. It takes a while to really ingest that and digest that idea. But it's true that's where that healthy component is recognizing who you are as an individual, where your worth is and where your value is. And it's understandable to get caught in a relationship to try to find that. But the reality is it's not out there. And that this might sound cheesy, and I don't want to sound cheesy, but it's actually in here. It has to be. It's important to define who you are in that relationship. The relationship can't really define who you are. And I don't want to get too far into the weeds. And I think that we've been talking a lot about the issue that I just mentioned, and we want to certainly stay focused on that. So this is something that you can do, and you don't have to be dependent on these relationships. Is that it's about defining yourself, identifying what your patterns are, those interpersonal patterns, and lessen the degree of relationship dysfunction so that you can better manage relationships, be in a relationship that you want to be in. And there's such a different feel to being in a relationship you want to be in as opposed to one that you need to be in. And I hope that these videos were helpful for you. I appreciate your time and attention as always. If you enjoyed it, please subscribe. Leave any comments that you may have. A lot of people read those and they find a lot of benefit. I try to read them as well, as many as I can. And thank you all very much for your time and attention as always. And I appreciate it. And have a good day. Have a good night. And have everything great. Take care. Thanks. Bye-bye.